Hi, this is Dr. Adajar from Chicagoland Men's Health, and I'm here to talk about the timing of taking your medication. Hopefully by this time you saw the other videos on how to take the medications, and if you haven't done so yet, I would suggest that you watch those videos first so you can get a better understanding of what we are going to talk about in this video. So the way that our clinic works is that the medication is delivered to your home directly from our pharmacy once we order it. And when you receive your package, you will receive all the medications as described in the other videos. Now, the timing on how you take these medications is very important because of how the medication works in your body. Okay, so let's take a look at a graph of how the testosterone cypionate medication flows in your body or works in your body over the course of 7 days. This is a graph of how the testosterone cypionate flows in your body over the course of 7 days. On day one, you're going to inject yourself with testosterone. Day one can be any day you want, it's just a matter of preference, just as long as you can be consistent. 24 hours later, your testosterone level is going to be quite high. That's when you want to take the anastrozole so that the testosterone stays testosterone and doesn't get converted to estrogen. As the week progresses, the testosterone cypionate is going to slowly wear off in your body. At the end of the week, on day 6 and day 7, you will be injecting 25 units of HCG, once on day 6 and once on day 7. The HCG medication is going to cause your testicles to make and release a lot of testosterone so that even though the testosterone cypionate is coming out of your system, your blood levels of testosterone is still quite high because it'll be your natural testosterone at the end of the week. Now, just as a quick reminder, the amount of HCG you will be injecting is 25 units or 0.25 milliliters twice a week. We have taken the liberty of loading you up with 8-month supply because the FDA has passed regulation that compounding pharmacies can no longer make HCG. We currently are working on alternative solutions and have actually several in the works. It's just a matter of deciding which one which one we choose will be best for our patients. After you start with us, it's important that we check your blood at regular intervals so that we know how therapy is going for you and that we have to make any adjustments in your treatment. Your first blood draw is at 3 months, and there are specific things that we want to check for. For example, we want to check the amount of red blood cells that are in your blood. 1 out of every 20 guys makes too many red blood cells in response to testosterone. You're going to feel great, you have a lot of energy, a lot of endurance, however, your blood will be thick. And if your blood is thick, you do have less than 1% chance of forming a blood clot. So as a precaution, we will arrange for you to donate blood, which will fix that right away. We also want to make sure we check your PSA, your prostate-specific antigen, for the possibility of prostate cancer. Testosterone does not cause cancer, but if you have one cancer cell in there, the testosterone may stimulate it. So we want to always follow your PSA levels. If we notice your PSA levels rising, we will repeat your PSA level. And if it's still high, then we're going to hold your therapy and then send you to your doctor, or we can arrange for you to see one of our physicians and who will need to give you clearance before we can restart your therapy. Following this, we also obviously check your testosterone levels, your estrogen levels, and make sure there's no adjustments in your dosage that is required. Then after that first 3-month blood draw, then we check you every 6 months for those same reasons to make sure that there's no adjustments in your therapy that is required. Ideally, we would like to check your blood on days 3 or 4 after your injection, because that's when your testosterone is leveled off in your blood, and so we can get a accurate level in your system to see where your testosterone level's at, so we can make any appropriate adjustments. So that should cover it regarding the timing of the medication and the timing of your blood draws and monitoring afterwards. If you have any questions, please give us a call and we'll do our best. So I hope to see you soon. Take it easy.